So this week is wrapping up National Infertility Awareness Week. It's a topic that many families are incredibly familiar with and others know not a lot about, but of course it's one of great importance and also a topic where there's a lot of stigma. So we want to try and unravel some of that tonight. I am joined by a doctor out of Pasadena, California. She is joining us here on Zoom now. Thank you so much for being with us, doctor. How are you?
I'm doing wonderful. Thank you so much for having me on your program, Julia. Really excited to talk with you and, of course, all of your viewers.
Yeah, so, and Dr. McDaniel, again, thank you so much for joining us here. We know you're based out of California, so there's a bit of a time difference from us here in Michigan.
Yes, a
But this
little
is
bit.
such an important topic to, just be talking about infertility awareness. Can you first walk us through just sort of your experience in this field?
Yeah, definitely. So I am what is known as a reproductive endocrinology and infertility specialist. So I'm a specialized gynecologist that has gone through 4 years of general obstetrics and gynecology training, as well as 3 years of focus training on reproductive medicine, including infertility and the preservation of fertility for many of our patients. So this topic of National Infertility Awareness Week is really near and dear to my heart.
And one that you obviously have a lot of experience in. And, this topic is one that can be nerve-wracking for people to talk about, something not a lot of people want to talk about. But of course, if you plan on growing your family, whether that's in a couple of years down the road or whether that's more immediate, of course, it's one that's of the utmost importance. Can you start me off with just talking a little bit about, the stigma surrounding this topic? It's kind of something that's shooed away for a lot of people, especially men. And, we want to try and unearth some of that here tonight.
Yeah, definitely. So, our practice actually recently commissioned a survey that was just released in March, and it found that over 51% of Americans surveyed were actually unaware of their fertility status, and 43% of these persons reported that they were actually afraid to learn the results of any fertility testing. So, first and foremost, I just want to tell people that knowledge is power. The vast majority of people aren't going to face any infertility issues, but for those that do, the earlier the better. Then we can come up with a comprehensive plan to tackle any issues that we might face.
Yeah, absolutely. Like you said, no one wants to receive an infertility diagnosis, but as you mentioned, the sooner you can get ahead of that, the sooner you can be asking questions and looking at solutions. That obviously is key. And for someone who may not be familiar with what an infertility journey can look like, can you walk through, from both the male and female standpoint? I know it's a lot to talk about, a huge umbrella of different
Yes.
scenarios, but if you're learning that that's a diagnosis you may have, what the future can look like for you when it comes to growing your family.
Yeah, definitely. I just want to let people know that there's many different types of healthcare providers in their community that can really help them along a fertility journey. You don't need to start the conversation with an infertility specialist. So there are many amazing primary care physicians, general OBGYNs who can get you started on your journey to conceive and refer you to those reproductive endocrinologists that are in the clinic. But a lot of our patients do start with these conversations, very important, with their family healthcare physicians and their OBGYNs, then ultimately make their way to our offices where we can do more directed, focused evaluation as well as any treatment.
Yeah, absolutely. And another topic that kind of goes hand in hand with, the infertility journey as a whole is male infertility. Unfortunately, one of the stigmas when it comes to this field is that it's an issue that only women have or only women contribute to. And obviously, this is a two-part journey that, that's not always the case. And male infertility, I know is something that I wasn't super familiar with and that I've recently learned about. And I do feel like my generation at least is starting to talk about this more, but can you walk us through kind of the basics of male infertility and, that either party can kind of play a role in, dealing with this and moving through it?
Yeah, definitely. There have been a growing concern about some rising rates of male infertility. And just like you mentioned, it's really important to take into account that cases of sperm quality contribute to about 20 to 30% of cases of infertility. Really, I want all of the couples and all of the men to know out there that there's a lot of really simple, sort of quick ways to test your fertility. Of course, going to see your reproductive endocrinologist, they can help you with that. But there's a lot of at home semen and sperm screening kits that men can use from the comfort of their own home to get an understanding of what might be going on.
Yeah, absolutely. And if someone is early in this process and there's learning that there's some sort of issue, there's some sort of trouble in their fertility journey, obviously this process can go so many different ways with so many different solutions or tests that can be done or procedures that can be performed. There's not a one-way path through
Yes.
finding your family or reaching growing your family. But can you walk through sort of some of the things that can be done just to unearth a little bit more about what this journey can look like if you do receive some sort of diagnosis?
Yeah, definitely. So when we have patients come into the clinic, we always sort of start out by explaining first and foremost that there's a few different sort of structures and parts of the body that we're really going to be taking a close look at. So the first is the ovaries. What does our ovarian function look like? Are we regularly releasing an egg every month? The second is our fallopian tubes, which are needed to carry the egg from the ovary towards the uterus where it can meet the sperm. We're also looking at the structure, the shape of the uterus to make sure that it's healthy to carry a pregnancy. And then lastly, which we already touched upon, we're also looking at the overall quality of the sperm to make sure that we have sufficient sperm to fertilize the egg that can then go on to form the embryo. And once we've evaluated each one of those parts of the reproductive system, we would address any issues that we can find. Then after that, we would talk about any treatment options. Two main treatment options are something called intrauterine insemination, where we place sperm directly into the woman's uterus, or of course, IVF or in vitro fertilization, which is typically our most effective treatment to help couples conceive.
Yeah, it's a complicated process, or it may appear complicated, but it's one that can be walked through and taken at each step, and then there's solutions depending on where exactly the issue may lie. So I appreciate you walking through that just to provide some more concept to this. I think we'll wrap it up in just a moment here, but any other message that you just want people to hear if this is a topic they're worried or confused about, just something that you want them to know, as someone who deals with this field every day.
Yeah, definitely. So there's so many amazing resources out there for anybody who's interested in learning more. So there's my practice's website, hrcfertility.com. We also have two amazing organizations, the American Society for Reproductive Medicine. They have a great website with a lot of simple, easy to read, patient-friendly materials, as well as the website for Resolve, which is our National Infertility Awareness Network. So recommend checking out all of those.
Great. Dr. McDaniel, thank you so much for talking about this and working to break that stigma and talk more openly about this for both men and women. I really appreciate your time, and hopefully we reach some people there who may be dealing with this journey and now maybe have a little bit more clarity or some resources to go off of. So thank you so much.
Wonderful. Thank you so much for having me, and have a wonderful night.
You too.